one. Well, hey there, everybody. Welcome to another episode of Andrew and Jerry Save the World, episode 98. The Barbarians are at the gates. I'm Andrew Langer.
I am Jerry Rogers, but this time, Andrew, it's been a while. I let the beard grow a bit.
Right. This is what happens when we don't do a podcast in 3 months, Jerry. And three
Oh
months ago,
my,
you were
don't say
entirely
that. That's
clean
too
shaven,
long.
and now you've grown a beard, and you look like you are going to appear on the album cover for the next Kansas album. But we'll set that aside. Really, we should have called it episode 98 Leftoverture, but we're not. We're going to jump right into it because our guest is a healthcare expert, Dr. Peter Pitts. Jerry, why don't you give us a little bit of Peter's bio
Well,
and let's.
I've had the pleasure of knowing Peter for a long time. He's a friend, but also I've worked with and around Peter on health policy for years now. He, of course, was at the FDA. He's a professor. He is the founder and the president of one of the most important health policy groups in the country, CMPI. Uh, and he is taking the lead on the policy side, intellectual side, on, and again, it goes well with your title for the show, Barbarians at the Gates. I would just say this: Peter has a piece. CMPI just published a piece that talks about barbarians at the hospital gates.
Yeah.
And we talk a lot about health policy on this program, on our other podcasts, on my radio show, Andrew. But Peter has really taken the lead on highlighting the health crisis when it comes to hospitals. So, Peter, welcome to the program.
Nice to be here. Thanks, guys.
Yeah, I mean, Peter, let's start here because I like to talk about the healthcare problems in America as resource economics problems, and certainly in terms of how that resource gets distributed and the impact on pricing to consumers. Hospitals obviously play a massive role in this. The consolidation of hospitals plays a massive role in this. Talk about the work that you're doing in that context.
Sure. Well, people say, "Oh, there's all this stuff. Why are we talking about hospitals? What is hospitals part of the problem?" Hospitals are the biggest part of the problem. People go, "Oh my God, the price of drugs and drug advertising." In this country, we spend 11 cents on the dollar of our healthcare dollar on pharmaceuticals.
Yeah.
We spend 35% on hospitals.
Right.
So, like Willie Sutton said, the reason he robs banks is because that's where the money is.
Sure.
So we focus on what's going on with the hospitals. Everything else is commentary. And Jerry and I have talked and written in the past about the issues with not-for-profit hospitals acting on a for-profit model and therefore failing. And I have a new paper that just came out speaking about the role that private equity plays with private hospitals. It's huge. I mean, in the last 10 years, private equity investment in hospitals has increased, ready for this, by $1 trillion.
Wow. And I'm sorry, is this both in for-profit and not-for-profit hospitals or just on the for-profit side?
Just on the for-profit side.
Got it. Okay.
$1 trillion in private equity money. So why is that? Because they have valuable real estate. They usually have a captive catchment of patients. They can charge more or less whatever they want for their services, and the government covers any stop-loss issues that they have. So it's a great investment, which is why they're there. They come in, they sell off buildings, they cut out services, and what happens is the balance sheet looks terrific. So from a PE perspective, they're making money, but mortality is up, outcomes are down, patients are unhappy, doctors are unhappy. So the commoditization of hospitals as that investment is not great for patients. I mean, Gordon Gekko of Wall Street said greed is good, not so good when it comes to hospitals.
Let me pin on that last point, the doctors, because my wife is a physician. I talk to her a lot about job satisfaction issues and the idea of doing more while being paid less, right? And for me, right, healthcare is a widget. It's the number of doctors times the amount of time that doctor has to see with the patient or another medical care, providers obviously in that system. But if you are making doctors fundamentally dissatisfied, if they can't practice medicine in the way that they should, or they believe they should be able to practice medicine, if they're being given more and more frustrating patients and being reimbursed less for that, that accelerates the decline in the supply curve of doctors. More get out, fewer backfill. Talk about the role that the private equity hospital problem plays in this.
And burnout. I'll come back to that too. The thing is, it's really important to say up front, this is not about disrespecting healthcare professionals, doctors, nurses,
100%. Oh, I get that.
People that keep the physical plant running. These people are being sold out by their upper management.
Yeah.
Whether it's not-for-profit hospital CEOs earning $8 million a year, or whether it's private equity investors denuding a hospital of its assets. All this results in is having the professional healthcare staff working 3 times as hard to accomplish half as much and burning out and wanting to quit their careers.
Wow.
There's no accountability.
Right.
Part of the problem is these things happen, and there's no stopgap mechanisms to make sure that patient care doesn't get impacted, which is why it does.
The paper you're talking about, the Center for Medicine and the Public Interest, CNPI's paper, was posted at Real Clear Health. This is for our listeners and our viewers. I'll re-up it, make sure it stays in the research section over at Real Clear Health. But talk about why we don't talk more about hospitals in terms of the cost of care, how they're not serving patients in the best way. And again, I know, and get back to burnout, but just talk about, like, why aren't we talking more about hospitals?
Well, think about this. Let's say you go to a Little League game, right? When's the last time you saw on the back of the Little League uniform Pfizer or Bristol Myers Squibb?
Yeah.
But never. But how many times have you seen St. Mary's, St. Vincent's? All the time. They are large employers in their communities. They are present everywhere relative to charities. They're seen as the good guys, the doctors, the nurses, et cetera, who work there are heroes, and they really are. But what people on the street at the Little League games, at church and temple, what they don't see is what's happening behind the doors. They don't see the $8 million CEO. They don't see the Lexus in the parking lot. They don't see the private equity play selling off assets. They don't see doctors burning out. They don't see doctors having more errors treating patients because they're exhausted.
Right.
They don't see more doctors, nurses just retiring because they've had enough.
Yep.
This is what's going on.
Let me interject here, Jerry, and let's again give some numbers that are out there. If you're a doctor or you're any kind of a medical care provider, there's a limited number of hours in a year in which you're going to be seeing patients. So, right. So let's say that you have a panel of 2,000 patients in your patient panel. That's the community that you serve. So each patient gets an hour of your time every year, right? All told, right? If everybody comes in once a year, it's an hour of time. By the way, Peter, we should never do math on the air. I'm doing math on the air, but just stick with me here. Let's say that the demand for that doctor's time, let's say somebody decides to say, we're going to increase the demand for your time by 20%. So that is another 500 hours of patients or another 500 patients that you need to see in that time. So now you're seeing 2,500 patients in a year in 2,000 hours. That cuts the amount of time that you have with each of those patients by, 20% or so. And so it becomes a situation in which now you have to see this patient. You have less time to interface with that patient. You're more tired, right? But also because you have less time with that patient, the number of errors is going to just go up. That's just simple math. Again, that's not poo-pooing the doctors here. That's something that nobody is talking about. And I'm sorry, Peter, it's one of these things where it's something we warned about when Obamacare was passed. Not that I want to put the blame on Obamacare, but part of the reason why these private equity firms are investing is because, as you point out, there's guaranteed returns here in all of this because of the way the Affordable Care Act has shifted the marketplace. Talk a little bit about this or respond to that.
What I hate the most is when I go to the doctor and I come with a whole list of questions because I'm old, right? And I hate when they look at their watch. I'm like, don't look at your watch when I'm talking to you.
Right.
It's rude. And it doesn't mean you want to know if your lunch is on the way. It means that my time is up. That's not, let me just read you this one sentence from our report. It says it all. Private equity firms are sucking the resources out of America's hospitals. That's what this is all about. It's more important to get return on my PE dollars than it is to enhance the care that these hospitals are giving to the community. And what's really frightening is that we can actually achieve both if we paid attention.
And let's be really clear here, right? When the doctor is looking at their watch, and obviously we don't want them to do this while we're in the room with them, but it's because they know at the end of the day they're going to have some manager telling them, well, why did you only were allotted 15 minutes with this patient or 20 minutes with this patient? Why did you take 25 minutes or a half hour to deal with this? And any doctor will tell you, listen, you can have it on paper what you think that the time is going to be, but the reality is when that patient presents with X, Y, and Z, listen, I went through this. I had a thing where I was hoping to talk to my doctor about my ear, but I had said that I needed a checkup because I thought that's the way it worked. You go in for a checkup and then you go and do no, apparently if I wanted to get my ear looked at, I had to come back and make a whole separate appointment, and who the heck knows when I was going to be able to get back in there. Jerry, I'm sorry. I know you wanted to jump in.
Please. So lately, I've become a big fan of the urgent care centers.
Sure.
In New York City. And what's great there is those doctors aren't being paid by the patient.
Right.
Paid by the hour.
Yeah.
So they're going to be with you for as long as you want to talk about your issues, and you really can sense the difference.
Right. Well, listen, it's like do you hire movers if you hire movers by the hour or you hire movers by the job? If you hire movers by the hour, they're going to take that much more time with you. I'm sorry, Jerry, go ahead.
Just so our listeners and our viewers kind of get the picture here, hospitals, nonprofit, for-profit hospitals are hiring and paying 6 figures, 7 figures to more and more administrators.
Right.
Again, it's similar to public school, where for every teacher now in some states, public schools, for every teacher, there's at least 1, maybe 2 administrators. And we're seeing an explosion of high salaried bureaucrats in hospitals, number one. Number two, to your point, how we pay or how hospitals charge is fee for service, right? And so you get into the case where the doctor's not listening, but the doctor's thinking, well, we can test for this or test for that, or there's someone else, a technician. I was in the hospital, Andrew, you know this, in January.
Oh my God, Jerry! Wait a minute, what?
Back in January, I was in the hospital, and it was amazing. I only saw my cardiologist once in 6 days, but I saw every tech, every nurse, every assistant nurse, every head, and every time someone came in, it was, well, we'll get this test, or we're going to give you this medicine, and I know that drives up the cost. And perhaps if my physician had more time to sit with me, I wouldn't have had to go through. Part of the reason why I was in the hospital for 6 days is because they were trying and failing certain medicines with me. And, they had to let me on it for a couple of days. It didn't work. We'll try something different. But again, maybe if I had sat down with my doctor and told him about my eating habits and my lifestyle and whatever it might have been, maybe it would have been better care. I don't know.
But hold on, Peter, before you respond. Hold on, Peter. So how much of this is defensive medicine, right? And how much of this is being driven by, getting reimbursement and being driven by the whole concept of P&E?
It's fee for service. Now, when for-profit hospitals and not-for-profit hospitals both operate on a fee for service basis, they are going to charge you as much as they can during the course of your visit. But their missions are different. Not-for-profit hospitals receive billions of dollars in tax breaks to be not-for-profit charity care facilities. For-profit hospitals are something different. And yet they're incentivized the same way, so they behave the same way. And then when you throw in from the private hospital perspective, private equity dollars, which is all about return on investment, full stop. You're not trivializing patient care. You're simply not taking it into consideration at all. It is not even an important variable.
So where?
Sorry, go ahead, this. The funny thing about this is, again, to Peter's point about the hospitals aren't known in the community. They sponsor events, community events, and baseball, Little League teams. But you'd think those engaged in health policy at the think tanks or on Capitol Hill and committees, there are numerous smart people working on health policy. And I get why maybe we don't hear a lot from it because the hospitals are the white hat, so to speak, the good guys. But I am surprised, especially when you're looking for cost saving and you're looking at healthcare reform. I am a little surprised that there isn't more bipartisan interest in this, because I've heard both D's and R's raise the question about private equity and what it's doing to hospitals. I've also heard from both D's and R's on how nonprofit hospitals are getting all kinds of tax goodies, benefits, and subsidies, but yet they're paying their administrators millions of dollars. And so it seems to be a bipartisan issue.
So you ask yourself, if hospitals are the biggest share of healthcare expense in this country, which they are by a lot, and not only is it not getting better, it's getting worse. I'll tell you, there's an Occam's razor solution here, which is politics. When you look at not-for-profit hospital spending on lobbying, they are generally the biggest spenders on political lobbying in their areas, and they do a really good job. Money talks. Even though they could have pictures of nuns running up and down, the hospital corridors singing from the sound of music. The truth is, these are big businesses who are lobbying, who are giving political donations to high-powered political officials, and they're getting what they pay for.
Yeah, it's interesting, guys. I know that you had done a piece for Real Clear Health where you emphasize the monies coming from nonprofit hospitals, political money going to elected officials. Again, I like the idea of putting your money where your mind is and supporting causes. But again, there ought to be more journalism going on, perhaps, and looking at the connection between why, again, what did you say? Drugs are 11 cents on the healthcare dollar. Hospitals are 35 cents. If we're looking for ways to make healthcare more accessible and more affordable, the right therapy to the right patient, the right time, at the right cost, it is frustrating for someone who works in this policy space not to be identifying and talking about hospitals more than we are. We need to talk about it more.
But also, raising standards, improving patient outcomes. The fact that we're simply ignoring it just speaks to the incredible power of the dollars that these hospitals are spending on lobbying.
So, Peter, let me ask you this, because I know we're running short on time here. Because obviously folks on the other side would turn around and use this as an excuse to say, well, if the profit motive is bad, and even if the not-for-profit motive is bad, it's still an independent entity. We should use this as a gateway to government-run healthcare. That's not a solution either, is it? And if not, tell us why.
That's worse for a whole host of reasons. Right. I mean, one of the issues with hospitals writ large is that there are laws on the books right now, federally and in every state, that demand transparency from hospitals, right? Hospitals just blow them off.
Yeah.
They simply do not comply with these laws.
Right.
I wish, Andrew, we had the dinger, because I'm so happy you brought this up, because you're right. We have reformed. There's been legislation enacted that requires transparency, and the hospitals are failing at it. How do we police that?
And the way you police it is to pass strong bipartisan laws that have outside entities looking at these hospital buildings on a regular basis. Right now, basically, hospitals police themselves, and we all know how well that works out. And that when you have government-run hospitals, it just exacerbates the problem, because all you have are the government regulating itself. No bueno.
Right. It's one of those things where I don't like creating new regulatory agencies, but we have a Federal Communications Commission, we have we have a Federal Trade Commission, we have a Securities and Exchange Commission. I mean, again, Jerry, you're going to hit me because if Jerry were here, he would be punching me in my face for what I'm about to say. But I mean, some entity like a hospital management commission. I mean, maybe it's time.
Andrew, how about this? And I'm interested in what Peter says, but Congress is infamous for bringing in the big bad CEOs, pharma or big oil. Why not bring in the CEOs of two separate hearings. Bring in the
Right.
nonprofit CEOs who are making tens of millions of dollars, and bring in these private hospitals where the equity is an issue, private equity is an issue. Bring them in and shame them on, and let's see it on CNN, on of course on our podcast, but there are other guys too, like CNN, ABC,
Right.
NBC, and CBS. Why not do a name and shame? Has Congress done that recently?
They have not. We just recently, Jerry's, come out with a whole series of reports on hospitals, and it's all about naming and shaming. We're talking about individual hospitals, what their CEOs make, their fair share deficit, which means the amount of money they get in tax breaks versus the amount of care they give for charity. Totally upside down.
Right.
And Andrew, we don't need more bureaucracy.
No.
All these laws are on the books. They're just not being enforced.
Right. I'm just saying it just in terms of who would go about enforcing them is my issue. I mean, right now I'm just assuming it's either somewhere at HHS or somewhere at the Federal Trade Commission, either one of those.
And a lot of it on the state level as well.
Yeah.
No. At the very least, maybe, Andrew, you and I work, and Peter, of course, we come in contact with the members of Congress who have oversight or health policy oversight. Maybe we ought to do some private lobbying and suggestions for the Senate and the House to bring in these hospital CEOs. Maybe that's our next piece. Our next op-ed on this topic is, Congress, bring them in.
Yeah.
I'll say, let's get the top 10 hospital CEOs whose hospitals are in arrears on the fair share deficit and earn over $5 million a year.
So, Peter, how do folks find out more about your report and the good work that you're doing?
Thanks for asking. A whole bunch of reports, including the new one called Barbarians, the Healthcare Gates, is at cmpi.org, right there on the homepage, written in plain English, frightening, timely, and I urge all your listeners and viewers to have a look at them.
Well, listen, Peter Pitts, thank you so very much for joining us today.
My pleasure.
Thank you, Peter.
Thanks. Well, that was such a great conversation, Jerry. I'm glad you suggested that today.
Well, Peter is one of the, again, best policy minds when it comes to healthcare, but also he makes complex issues conversational.
Oh, that's a phrase I've used in the last couple of weeks.
But it's the truth, and I do think this is an area where, we're going to have, it's September now. We're recording this in September. You and I both know that come the late fall and winter, we've been told there will be a health care package dropped on the Hill.
Sure.
Looking at PBM reform, pharmacy benefit managers,
the middlemen, Jerry, the middlemen, the big bad middlemen.
Pricing reform. The president has dropped this week, restrictions now on direct-to-consumer advertising for the pharmaceutical industry. We know that Dr. Oz, CMS, is looking at how to save money in Medicare Advantage. There's so much happening. Hospitals should be part of that conversation.
Yeah, there's something happening here, Jerry. What it is ain't exactly clear. So there is something else. Speaking of which, because it's been a bit, man. Oh my God.
Well, speaking about Barbarians.
Yeah.
The issue of Barbarians, for our viewers, I called Andrew yesterday.
Actually, time out. Before we talk about what happened down in Charlotte, can we just dovetail something onto this? Because I got a question that got asked to me today. Because the Maha report dropped yesterday.
Yes.
And obviously lots of discussion, and it goes along with what we're talking about here as we're talking about healthcare. I'm sorry, Jerry, I want to try to do some kind of linear segue, and we'll talk about Charlotte in a minute. But I got asked a question because one of my warnings has been that we don't want to do stuff on nutrition policy that gives an opening to the left down the road to do the same thing back to us, right? If we ban sodas today, what's to stop us? This is a point that I made in a meeting earlier today. What's to stop President Newsom and President Newsom's HHS from saying red meat is bad, now you all have to eat bugs? And somebody pointed out to me after the meeting, well, there's a philosophy that says they're going to try to do this anyway, and we should do as much as we can now.
But here's what I understand, though.
Yeah.
What is we must do as much as we can now? What does that mean?
Well, that means that if we're going to shake up, we can't use the
chemicals.
What was that?
Well, does that mean banning GMOs, banning chemicals? I
Well,
mean,
this is the point, right? It's the idea of whatever happens to be in the popular mindset on nutrition policy or what have you, that we shouldn't be worried about how the left might use those powers against us. And so I made the point to this person. I said, well, maybe this may be the difference between the old right and the new right, or the old right and the populist right, is that I have a real aversion to hypocrisy. That which I said was ideologically bad remains ideologically bad if our friends do it. And I'm not sort of, gender fluid about it, ideologically fluid about it.
to your point, I mean, look, I am against uh, 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 high taxes, targeted taxes on soda.
Right,
I'm against banning foods from SNAP because it is a slippery slope.
right,
And I don't want the grocery store to become an agent of the government,
right,
where it starts in SNAP. But however, what about to your point, the massive healthcare costs?
right,
Well, maybe we should be monitoring how much red meat people
right.
purchase.
Exactly.
Maybe we should
Or
be
put
monitoring.
a fat stamp on people's foot in people's
Exactly right.
healthcare records.
So, I haven't had a chance, to read the Mahat report
I've
yet.
started to.
I, I, again, just to take one step back, I like the conversation around nutrition.
Right.
I think again, there's an emerging market here too, and I've had them on the my other podcast, the Business of America, where there are folks who are uh, uh, in this space, food as medicine.
Right.
Right.
Yeah.
And I like the idea of getting the US population off of all these meds and having better diets. I think
Sure.
especially young people. Liam, for the audience, I have my youngest is Liam. He's 11. He plays all kinds of sports.
Happy
And,
belated
as
birthday.
his dad, as his dad, I make sure that he hydrates. I make sure that he's eating proper food. It doesn't mean he doesn't get to eat candy sometimes or have a treat, but the fact of the matter is, if he's going to be an athlete, he has to fuel his body. So I like the conversation. What I don't like is the heavy hand of government, whether it's my side or the other side, using government to be the nanny. There's too much nanny statism.
If you don't want government to get in between you and your kids when it comes to what happens in their schools and curriculum, right? Then you don't want government to get in between you and your kids when it comes to nutrition policy.
Right.
Right. I mean,
exactly right.
It's just a matter of consistency here. And that's part of the case
Tell
that
you
I
what,
made in my
if you want to
presentation.
reform SNAP, first of all, I think SNAP, by the way, is one of the welfare.
And time out for a second. The goal is to get people off of SNAP.
Yes.
Yes.
Thank you. I'm so happy you said that, because this is where I was going. SNAP is a program that is important because
Right.
Someone who's a construction worker gets laid off because there's no building. Well, SNAP is a way for him to get by. Part of the problem now in the healthcare space is we're judging success by how many people are on Medicaid, how
good
many
point.
people are on SNAP, how many, and again, the governor in my home state, Wes Moore, literally will say that it is a crisis that folks have to be eligible for certain Medicaid program. I'm like, no, Governor, no, it's not. Our goal should be that no one's on Medicaid.
Right.
Medicaid is important. Our goal should be no one needs SNAP.
Right.
Our goal should be no one needs charity care. But again, we have really made up, down, down, up, where we have politicians who judge success by how many people are dependent upon the government.
And guess what, folks? This is how you get situations where someone can be arrested in Charlotte multiple times and let out on the streets where they are certifiably crazy, and they go crazy on a public train, and kill somebody. I know it seem like a ham-handed segue, but if you're in a situation in which you have been indigent, and because of pressures in terms of how those indigence programs are run, that someone is essentially in a revolving door with law enforcement, That's
Actually,
sorry.
that is a very good segue because we
Yeah.
don't talk enough about there are people who need to be in a charity care situation, a
Right.
Medicaid situation, but they get priced out
Right.
or they get cost out,
Right.
and because there are healthy people who are able-bodied, who are on these government programs and shouldn't be, and then there are people who should be in institutions or on certain programs and they're not because again
Right.
because we have this whole thing upside down. I will say this though, one area where the government has a clear role is public safety.
Right. Of course.
One area where the government has a clear role is to promote policies and laws that actually protect the social order, protect the rights of citizens. And it's again, even here, this horrible case. I can't look at this video and this picture of this poor woman, this girl, this young girl,
No.
23 years old,
Girl who fled,
who
who came to America because a brutal thug had attacked her country,
and
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 the Biden administration and the Obama administration essentially created the circumstances by which this war could occur. She comes here to flee violence and gets attacked by this crazy person on a train.
right, but again, I want to make sure that there's so much to say about this, but let's start
Yeah.
with
I'm sorry. I've hijacked the conversation the way.
how did the circumstances
Yeah.
become such that this man is out?
Right.
And I'm going to put the blame square on the Black Lives Matter movement, on the post George Floyd so-called reforms, the racial equity reforms, the DEI reforms,
The
George.
Soros-driven reforms.
Exactly right. So you have prosecutors who don't prosecute. You have judges who let criminals go. We don't treat the criminally insane as the criminally insane. And again, a lot of this has to do with ideology. I was furious with the media broadly because they didn't cover it, and then when they did cover it, they used it as a way to bash Republicans, saying that Republicans, MAGA, using murder,
Right.
Charlotte murder, as a way to attack Democrats. They couldn't even cover the story with any kind of empathy or decency. But the fact of the matter is, I was furious with the politicians who first came out and said, there's no there, here. Don't look at the video. Thank God our partners in the media did not show the video. And then you had Roy Cooper from North Carolina, right?
Yeah.
Saying, blaming Trump.
Right.
Saying that his cuts to law enforcement. And again, how cynical. Governor, you're the one who enacted these DEI post-George Floyd equity reforms. You're the one who your police arrested this man 14 times.
Thing Roy Cooper, Jerry, the only thing Roy Cooper didn't blame Donald Trump for was saying that it was the pardoning of the J6 rioters that led to a disrespect for the law on the part of this person.
The early days after this murder,
savage attack.
The New York Times had done zero stories on it. However, when you look at the Daniel Perry,
right,
he was the subway hero who intervened when a crazed lunatic, murderous lunatic was acting violent in the subway. He put him in a chokehold. That person passed away. The New York Times did 100 stories on that.
Right, and how horrible Penny was. Yeah.
And I'll say this too, and you have daughters and I have daughters. We're teaching young people wrong lessons about being situationally aware.
100%.
And again, you see that person who is unkempt, with the dreadlocks, unwashed, with the hoodie on a warm summer's night. Don't sit next to him.
Right.
It's not racist to say, he looks dangerous. I'm not going to sit there.
Right.
We need to teach our women, our girls. We need to teach them to stay away from predators. And we're not doing that. We're telling them, oh, don't judge by the dreadlocks. Don't judge by the outfit. Don't judge that he's muttering to himself. Yes, judge,
Right.
profile, and don't sit there. I'm sorry.
But the other part of this is the issue of the bystanders and what the prosecution of the Daniel Penny, was Daniel Penny or Daniel Perry?
Daniel Perry. Perry. That's
Daniel Perry in New
Perry.
York.
Did I say Penny? I apologize.
No. I said Penny. And I don't know if you can hear the vacuum outside, Jerry, but maybe you can.
I don't hear it. Don't worry.
Good. You can't hear it. We'll try to ignore it. You know, the problem is when the New York Times does 100 stories, essentially outlining how it was absolutely right for this guy to get charged and absolutely wrong for him to intervene. When the left goes out of their way to make it so that there aren't people around who can serve to help defend their fellow citizens when they're under attack, that's also what you get here, where there are people who all they can do or all they are willing to do is stand aside and watch in horror as this woman is quickly dispatched by this lunatic who should not have been out on the streets.
Let me be very specific here.
Please.
Men need to step up in our culture. Men need to be protectors.
Right.
I'm sorry. This sounds misogynistic. It's not. Men need to protect those around them. When I was a kid on the subway, because New York was such a dangerous place, I carried a knife with me.
Right.
As an 8-year-old. Why? So I could defend my little sister and defend my mother.
Right.
That's how my father raised me. I'm afraid, Andrew, that we're not raising men to be protectors now.
I think there's that aspect of it, Jerry. Right. Obviously, this is in the war on boys, but also we should be empowering our women to act on their behalf.
Of course. Yes, of course.
And that's not that listen. Setting aside this woman from Ukraine, this Ukrainian refugee. I'm not born and raised in America, but if she had been born and raised in America, right? If she were from Texas, she would have a certain way of handling herself in this situation. She was even born in New York, right? Right. Here's the thing. At the end of the day, your average.
That's true. I hope that's true. I get a sense that we're teaching girls that they don't have a right to a safe place.
I think that's true. No, Jerry. I think that is certainly true. 100%.
Men are in their private bathrooms. Men are invading their sports, and we're also telling them that don't judge that person, that man, if he looks.
You
dangerous.
and I may have seen the same thing on Facebook today because we share a lot of friends, and I don't remember which of our mutual friends it was today. It was talking about her daughter being at college. And being deeply concerned about the idea that a boy who is claiming to be a girl is going to be sharing the bathroom with her daughter at a college.
I didn't see that. That is unacceptable.
No, and the fact that her daughter doesn't feel comfortable in saying that there's something wrong here with that. Well, and that's a whole other thing.
After the and we didn't talk about this, but after the transgender person shot up little children at Annunciation.
Which one, Jerry?
The point is that we have to stop the nonsense.
100%.
Good people have to say enough is enough.
Right.
Our social order. The rise of transgender is a breakdown of the social order. The rise of crime. I'm sorry. I don't want to hear from my libertarian friends, well, crime is actually down over the last 2 years. Screw you. Go anywhere, and nowhere in America should be a no-go place.
Well, anywhere
I want, anywhere in America.
The bottom line here is you can't trust the statistics that are out there because the books have been getting cooked for so long. Yeah.
But even if crime,
hold on for a second. Yeah. This is 2025, and let's not forget that in 2024 we had election going on. That crime was a huge driver in that election and a huge driver into getting Donald Trump back in power. It was a huge knock against first Joe Biden and then Kamala Harris. So what did the Democrats do in major cities? Is they cooked the books. We had on, and I unfortunately can't remember the woman's name, an author who writes for The Examiner. And she finally told her story about having been attacked in DC, a repeat offender who'd been released multiple times, sexually assaulted her in the streets. The revolving door was let out immediately again, and in the space between when he assaulted her and when the trial finally happened, assaulted several other people. And that's not the damning part of it. I mean, that's part of the damning part of it, but the other damning part of it is that her situation would not have been caught up in DC's crime statistics because of the way DC cooked their books on this. And so, our libertarian friends who are supposed to be all about the data should be the ones shouting to high heavens about, especially in terms of their mistrust of government, right? You mistrust the government, be ideologically consistent. You should not trust government data regarding the way the government is reporting crimes
again,
in big cities.
Just to underscore your point, during the Biden administration, we found out that the Department of Justice was indeed cooking the books.
Right.
We now know that Washington, D.C. was cooking the books.
Right.
Baltimore City, infamous for cooking the books in terms of crime data. Again, but my point is, even if crime isn't as bad as it was in the 80s, it doesn't make a difference.
Right.
Baltimore, I drive in and out of Baltimore every week, and there are sections of that city that you cannot walk through.
Right.
In fact, it's dangerous to drive through it. And that shouldn't be the case anywhere in America. By the way, the National Guard debate. The fact is, if there were National Guard troops on that train, maybe this doesn't happen.
100%.
We could, and this idea that again, from our libertarian friends, that somehow this is tyranny. Again, it is a load of nonsense. The posse,
Posse comitatus. I know you can't say that word, Jerry.
Allows for the president to use.
What did he call me? He called me something communist. Yeah, no, yeah.
There is an exception to the law that allows, if federal law is not being upheld, then the president can indeed send in National Guard, can send in troops. And I don't know. Baltimore is dangerous. Chicago is dangerous. L.A. is dangerous. My hometown, the Bronx, New York. There was a double shooting
just a couple days ago
in a relatively safe neighborhood recently. I mean.
Yeah, hey, hold on. Before you gloss over, which neighborhood was that? Because I heard about the shooting. I just didn't know what neighborhood it was.
It was just north of Little Italy.
Oh, wow.
In the Belmont section of the Bronx.
Wow.
Yeah. And so my point is that government government must protect the social order and protect the rights of citizens. Even if Tim Kaine, senator from Virginia, doesn't understand that our rights don't come from the government, don't come from politicians, they come from nature or from God. The fact of the matter is, governments are only instituted to protect those rights.
100%.
This woman, her rights weren't protected. We need, again, I support what the president is doing, highlighting crime. We can't move forward on this, Andrew, and not talk about the racial component here. If this was a white man who murdered a black person and then muttered, "I got the black girl, I got the black girl," this would be wall-to-wall coverage. There'd be all kinds of calls for commissions and studies. There'd be violence and riots in the street. We have to do something about the conversation where we have to say that there is a black male crime problem in this culture.
Well,
period.
I mean, it's a situation where it can't revert to. This is something that is now being injected by the president or by Charlie Kirk or whoever into the discourse.
Heather McDonald, who's an expert on crime and urban policy, was on a podcast just this week where she said, using statistics that are publicly available, that if you are a white person, you are 35 times more likely to be attacked by an African American than vice versa. Well, why aren't we talking about, and again, Andrew, this person was mentally ill.
Right.
I also believe that we're teaching a generation of black men that they are put upon, that everyone's against them, that you are entitled, that everything is racist. And so what happens is you get two football players or two kids at a game, and one kid is in a place where he's not supposed to be. The other kid says, "Hey, this tent's for the team. Get out of here."
Yeah.
That person then stabs the kid and
Right.
kills him. It was an African American boy who committed the murder. It was a white kid who said, "Hey, you don't belong here. This tent is for
Our team.
For the team." And instead of the guy, he stabbed him.
Right.
Well, he disrespected me.
Right.
I mean, we got there's more racial acrimony in America
Well, Jerry,
today.
listen,
Andrew,
it's very simple.
compared
It's
to when we
very
were
simple and
kids.
straightforward. And it's a conversation that I've had, regarding my own high school, right? Which has been in the paper over this. When you spend decades, literally decades, highlighting the differences between people on a racial basis, right? Highlighting the differences and creating a hierarchy of victimhood. You cannot be surprised when, within 30 years, you have people turning against one another. As I said to somebody, a couple of years back, I said, the way it used to be, we're all together, we're all the same. Let's highlight and celebrate what brings us together. But somebody didn't like that in the 1980s. And I don't know, Jesse Jackson, Al Sharpton, whoever, didn't like the fact that we were coming together as a society, and so all of this divisiveness was fomented. Listen, Jerry, unfortunately, we gotta call it with that because I gotta get to a thing. Are you back on the air on Sunday? Obviously.
Yeah, WBAL. If it's Sunday, it's Jerry, 7 a.m. And I'm going to cover this topic. There are things we didn't get a chance to talk about, like how the press didn't cover it, how when they did cover it, they blamed MAGA, how the press came immediately to defend the Democrats. By the way, let's put the fault where the fault is. This has to do with ideology. The post George Floyd ideology, the DEI ideology, the America is evil, everything is slavery, reparations ideology. We need to teach right history. I'll end with this. America, by the way, the West
on the
UK,
250th anniversary, by the way. So thank
America,
God
by the
Kamala
way,
Harris isn't president.
wasn't founded on racism. In fact, our declaration, we wanted Jefferson wanted to condemn slavery, but two states wouldn't do it.
Right.
So then, when we wrote the Constitution, we did begin the process of outlawing slavery. When America became a nation in 1776, 7 states outlawed slavery. Right. First in Western in the world. Right. America and the UK are the first places in the world in human history that outlawed slavery. Right. We have to start teaching the truth about race and slavery in this country.
Hear, hear. Jerry, you do the Business of America podcast. You got a bunch of those coming out. You can find Jerry at Real Clear Health, Real Clear Policy. I do my lunch hour podcast once a week at the Federal Newswire at Lunch Hour Pod. Follow me and listen. Let your friends and family members know. Hit the like button. Hit the subscribe button here on Andrew and Jerry Save the World. Jerry, what do you want folks to do?
Find the truth because it's needed more than ever. And plant your feet and stand firm. God bless you guys.
Have a great week, everybody. Have fun and please stay safe.